Hello, so this is about Kennebec behavioral health. Subscribe to the channel and smash that like video. So learn about KBH. Accredited every 3 years, 170 plus towns with residents served. 1 in 5 suffer from mental illness. Greater than 13,000 Maine residents served by KBH. So they've got adult rehabilitation services, community living and integration, development case management, behavioral health homes, and vocational clubhouses. Clinic-based substance use disorders, psychiatric service, outpatient, child and family services, and housing and outreach. So clinic-based services. Kennebec Behavioral Health has clinics at 67 the following addresses, so you can pause, but it's in Waterville, Augusta, Skowhegan, Winthrop, and Farmington. Services include outpatient services, counseling and therapy services for adults and children. In-home clinical is also offered for clients who preferred services in their home. Substance use disorders and services and co-occurring disorders. Treatment for substance use disorders for people dealing with co-occurring substance use disorders and mental health problems. Psychiatric services, clinic-based psychiatric evaluation and medication management. Call 1-888-322-2136 for more information. They have adult rehabilitation services. So adult rehabilitation services include community integration, case management and community support for individuals experiencing mental illness, community living services, skills development and community rehabilitation services with medication administration, and daily living skills training. Development services, case management, helps adults with developmental delays reach their goals and meet their needs through individual planning, support, and connections to community resources. Vocational and psychosocial clubhouses, evidence-based practice and membership model of psychiatric rehabilitation with employment skills building and transitional employment. So they're in charge of Capitol Clubhouse in Augusta, High Hopes Clubhouse in Waterville, Looking Ahead Clubhouse in Lewiston, and Village Clubhouse in Topsail. Behavioral health home service, integrated care of adults and children experiencing significant physical health issues, chronic conditions, as well as behavioral health challenges. They have developmental service case management. So our developmental service case management service is for adults who the state has determined are ineligible for case management based on MR diagnosis. People with Asperger's and autism could also qualify. To make a referral for this program, you need a copy of letter of eligibility, which initially comes from DHHS. To get an eligibility letter, the family contacts Barbara Davis at 207-474-4923 to schedule an eligibility determination meeting. Barbara will then schedule to meet with an individual or the family to gather information needed to schedule an assessment. Once eligible, Barbara can send a referral directly to KBH. If requested. KBH case managers help with the development of individual service plans called PCPs, Personal Center Plans. Case managers will also make referrals, complete assessments, coordinate services, ensure that client goals and needs are being addressed, and monitor consumer satisfaction. So case managers can help link people with services such as Section 29 day program services, where the goal is to increase and maintain a person's ability to successfully engage in inclusive social and community relationships. Section 21, home support services to improve a person's ability to live independently. Section 17, in-home and job supports for MOH and MR vocational rehabilitation. Section 28, for people under 21 years old who need help with skills development, therapy, communication assessment, transportation, food stamps, and guardianship information. So they cover Kennebec and Somerset counties. They have child and family services. So child and family services, children case management, coordination service, options for children and families, including assessment, referral, monitoring, and advocacy. Home and community treatment, helping families address unwanted behaviors and symptoms of children with education and skill teaching. Multi-systematic therapy, evidence-based practice for youth and mental health and behavioral issues. School-based services, mental health services in schools in collaboration with parents and school staff. And behavioral health home services, integrated care for children experiencing significant physical health issues. They have housing and outreach services. Housing and outreach services include homeless adult outreach. Services include outreach, engagement, assessment, case management, housing supports, homeless youth outreach for youth who are homeless, runaways, or at risk of these situations. Rental services, rental subsidy program for person with mental illness. Residential service, 24-hour structured residential service and supports for person with mental illness. And supported and transitional housing. Community living for homeless, mental ill consumers who need support in maintaining stability. They also have some behavioral health home services is a service for youth and adults experiencing a combination of mental health challenges, as well as significant physical health issues such as diabetes, heart disease, and lung disease, and chronic conditions. So they help people served live longer, avoid emergency room and hospital visits, foster a sense of self-sufficiency, dignity, and respect, and provide integrated care between mental health, substance use disorders, and primary care needs. They differ from case managers because the service focuses on the whole wellness. It will help you reach your mental and physical health goals. You'll be part of a team approach. You will begin to working with your case manager. You will work with your nurse, clinical team leader, and peer support specialist. Your team and your primary care provider will work to help you improve your health as part of your integrated service. BHHS includes a consumer and family support and education to provide you with information and support when you need it. So they also have representative payee services. KBH has approved by the Social Security Administration to become a fee-for-service agency, providing representative payee services to clients in need of financial management. KBH understands the importance of this responsibility. We strive to provide exemplary service and gain trust and peace of mind, knowing that all financial needs are met. So, the responsibilities of the representative payee are determined by you, your community provider, and your rep payee. We'll ensure that all current and foreseeable needs are met: primary food, shelter, clothing, and medical expenses that are not covered by Medicare or Medicare, Medicaid, or Medicare. Once your basic needs are met, your remaining needs will be discussed during monthly budgeting with your community provider. We will be encouraging you to develop a savings to use in times of need. We will also support you in taking appropriate steps if you have interest to becoming your own payee in the future. Your community provider. It is recommended to have a community provider to support you with completing your monthly budget that is developed by your representative payee coordinator. So fee for service, KBH charges a payee service fee. The rates vary but cannot exceed $41 per month and will not exceed 10% of the monthly income. Our fees include all postage, checks, and envelopes, stop payment fees, administrative duties, and responsibilities. So there are some concerns with this. I won't have any say access to my money. That's false. You develop the budget with support to make your monthly finances work for you and problem solve ways you can pay bills. So if someone can steal my money, false. You will be provided with a breakdown each month of every dollar spent and upon request. Where can I learn more? KBH follows the guidelines from the Social Security Administration using the Guide for Organizational Representative Payees. So for more information about this, you can contact their payee service by calling 873-2136 extension 1002. So contacts and locations, call and inquire about comprehensive behavioral services. They have the Access Center. I'm just going to go through this here. You can pause and stop if there's anything, because there's a lot for their services. Because they've got Waterville, Winthrop here. And then Augusta and Lewiston. And then Skowhegan, Farming, and Thompson. So thank you for listening.